I am Courtney Fisher. My PowerPoint is about phonetic transcriptions of speech-language pathologists. Some personal background. My hometown is Bembolt, Texas. It's like in between Alice and Kingsville. So like a little after Kingsville, you would keep going straight, or I guess not straight. You would go. I don't know the highway. I can't tell you. I can try, but it won't work. But it's right before Alice. It's really small. You'll easily pass it if you're not careful. Um, I live on a ranch. I have 2 cats, Rune and Trouble. I went to school in Bembolt. Here's a picture of me from graduation with my current boyfriend right now. I chose to be a CSDO major, which is Communication Sciences and Disorders major. I know, long name, but it's really fun, I promise. My future aspirations is to be a SLP and work in a clinic or speech language pathologist. I don't want to be an assistant, but I'm also kind of thinking maybe I should be an assistant. I think it would be fun. But I really want to work in a clinic with kids because, well, they're kids. Like, I feel like they're easier to talk to than most adults, even though I will have to deal with parents. But I don't know. I think they're more understanding, I guess, of words than adults are. Or because they really do want to learn, while some adults kind of struggle to want to learn unless it's like necessary for them. Oh, and I'm kind of covering this picture, which is supposed to go with the SLP, my major. Pretty much the picture is both clinicians using activities to inspire a child to like say words, I'm assuming. My references that I used for this assignment was assessments and treatments of speech sounds disorders in children. It's a really good book to read. I actually was reading it for one of my classes because, well, my class this semester was speech sounds, and it has a lot. Well, not a lot. Like the first few chapters do deal with phonetics, but it's not like a full in-depth one, which is kind of nice because it does talk about other parts of speech pathology that I might want to know for future reference. And then the other one I used, which actually does deal with phonetics, is Fundamentals of Phonetics, a Practical Guide for Students. I will not lie, it was a bit hard for me to understand it when I first started reading it. Why did I write about phonetic transcriptions? I wrote about phonetic transcriptions because I wanted to find an easier way to understand them. I struggled with understanding every part of phonetics, so I thought writing about it would help me understand slightly more. And honestly, it kind of did because, well, phonetics, it's kind of complicated, which I'll go over in the slides, but there's so much to do with it and there's always different ways to say things and write them down, that writing them down was kind of difficult for me to do at first. And you'll see why. Phonetic transcriptions is just like the English alphabet. Phonetics uses sounds and symbols to create sentences. I should have included sentences in this, but I didn't. Speech pathologists use phonetic transcriptions to translate phonemes and allophones. Speech pathologists use International Phonetic Alphabet, also known as IPA, to represent many phonemes of the English language. So, like, when you think of the English alphabet, you think of A, B, C, D. Well, phonetics has that, but they do not look like A, B, C, or D. I mean, some of them do, which you'll see more, but it does not actually have anything to do with them. The most that they have in common is the slight same symbol and the same sound. That's all. Vowels are difficult to understand, to be honest. This is the one I struggle with the most because of how they're spelt. They're practically the same as the regular alphabet, but not exactly, as you can tell by the vowel quadrilateral, which is right here. The front part is where your tongue is, or not your tongue, the roof of your mouth, and the back is where your velum is, so like all the way back where your like soft palate is. Um, so there's the I, E. So for example, like I could do key, so it's the E, win, in, then rebate, ebate. Oh my gosh, it's rebate and E, and then it's red, and then ha, moon, wood, okay, law, cod, about, bud, butter, and bird. Which I wish it was a little bit bigger so you can actually see them. But you can see where, kind of how they would be spelt. You see the vowels transcribed and what they actually look like in English. So it's like it sounds the same and kind of looks the same. But when you look at, let's see, about, you're looking at it and like, how do you get that spelling? Honestly, I'm still trying to figure that out. But it's because of the ah. I don't know why it's an E, but that's how it got, that's a symbol for it for some reason. Which honestly, it's kind of cool though. So we kind of focus on the vowel quadrilateral a lot because you need to know if they were a front high or a front mid, a central mid, central low, central back. Because you need to know these so that when you're treating clients or, excuse me, something like that, you kind of have to know where to help them. Excuse me, gosh. Sorry, I'm gas. Diphthongs. Diphthongs tie directly into vowels. Once you understand how vowels are produced, you will understand how the diphthongs are made. Diphthongs are two distinct articulations, like an on-glide and off-glide. So it's a, oo, tie, e, ide, boy, oi, sorry, bay, a, ow. It's weird. I'm still practicing on how to say them exactly, so I still say the whole word to figure it out. Wait, why did this? Oh, sorry. My screen was a little weird. Consonants. Consonants are almost the exact same as a regular consonant. They have the overall sound and slightly different symbol. For example, in think and the th in them and them. You can kind of see and you can also kind of hear the slight difference between think and them. Think and them. Them kind of has more of a z into it, while think doesn't really have like a sound with it. For most consonants, like you can kind of see the P, B, T, D, okay? They practically stay the same, aside from the B, or the age, like beige, j, that's the word, sorry. And then the chew, and then there's the j, and that's pretty much the only ones. Oh, and the ng. It's kind of hard to say the ng, n, ng. There you go, ng. For like ring. It's kind of hard for me to pronounce them, but those are like the only ones that have a different symbol change from the English alphabet. I honestly cannot pronounce this, so I'm just going to call it R-colored words, or I guess I can try. Rotization, which is also known as R-colored words, though I just call it the R words because I only know them as R's. Most R-colored words are vowels with a consonant phoneme, like R. We know R because we can do a hook. R, like a pirate. Lure, and then there's ear. Then there's air, and then there's or. Those are the only ones that I know about. There might be more, but this is the only part that my teachers have taught me that are R words. Why won't it let me go to the next slide? Uses for phonetic transcription. Speech pathologists often use phonetic transcriptions in everyday work settings. Speech pathologists use phonetic transcriptions to see differences in clients' phonemic inventory. A client's phonemic inventory is very important to document, as if we don't know if they have all their phonemes, they might have some sort of disorder. Or I don't think it's like necessarily a disorder, but it's more like they won't be able to say a certain word or certain sound for a while. And we kind of need to know their inventory so that we're able to help them pronounce it, find the perfect pronunciation for them so they can actually develop the word. Phonetic transcriptions are kind of like the ones that I practically showed between the R-colored words, consonants, vowels, where it has little dashes. Oh, I guess the other way. Dashes, and then it's the word. But you could also do the dash, the word, and then another dash, or a dash the sentence and another dash. You don't even have to add periods to it. Or it could be a phrase, and speech pathologists would follow that phrase. Because it's very important to see what they're saying to make sure we're documenting it. We use CAP testing. Well, this is one of the many tests to check for inventory in a child or a patient or an adult. The CAPS-2 testing, also called the Clinical Assessment of Articulation and Phonology, is an assessment to evaluate articulation and phonology that is usually tested on children from age 2 years old, 2 years 6 months to 11-year-olds. The test has valuable information on the client's speech production. This test it may have all the words, like it'll have consonant, vowels, diphthongs, R-colored words, but in this we're really just looking at consonants. If it's the final, medial, or initial. Usually most of them, like if you kind of look a little close on one of the checklists, you see if there's a syllable reduction. Is one of the syllables being deleted? Is the patient deleting a syllable? So like in one of them it says computer. Maybe the patient is saying compute, and you don't hear an so they are deleting a syllable. Or like in another example, you can see where it says final consonant deletion. So maybe they're not saying the G in pig, it's pi. So they have to mark it as no, they are not saying it. Or, I mean, yes, they are deleting the final consonant. Or maybe their glides aren't working. They can't say the ul. So you have to mark yes, they can't say ul. Or no, they can say ul. Or maybe they aren't. Or maybe a liquid is being replaced by a vowel. So instead of saying jar, they're saying jaw. Something like that. I'm not too sure exactly because I barely learned about it, and even at that, it was kind of like quick. We didn't have much time on it. Hearing the differences in speech. It's very important that you can hear the difference in speech because when you are working with a patient, you need to be able to tell the difference in sounds. So most teachers do recommend you, whether in a public setting or having a conversation with a friend, we should start analyzing people's speech. Well, you don't have to tell them anything, but you in your mind, you should be analyzing how they're talking, how they're pronouncing words, how maybe they say something weird, or maybe you can see that their tongue is thrusting out with certain words, and they have a slur or they're stuttering. It doesn't come right away. I'm still practicing, so not even I notice every little difference from my speech to somebody else's speech. But we need to start training our ears to be able to tell and hear the difference because it's very important in the clinical setting, especially when we're transcribing. We need to be able to hear what they're saying and transcribe it down as quickly as possible because, well, you can't ask the client to repeat it because, well, they might say it differently than the first time. Syllable shapes. Syllable shapes, it's a CV, so it's a consonant vowel structure. Speech pathologists use this technique to check a patient's structure. It's a way to make sure they can say most of their consonant and vowels or the other way around. There's always a mixture that speech pathologists can hear. They range, like the structures can range, but they usually have a CV structure. Sometimes though, there is a VCV, or you can also see on the side, it has a co, CV, cat, CVC, da, CV. I don't have it here, but maybe there's an aba. It would be a VCVC, VC. So we have I didn't even notice that's messed up. Sorry. My fault. But pretty much we would check this structure more than once, see how they're pronouncing words. Though I'm assuming this is really for like 2-year-olds and under, or above slightly, only because, well, it's not a common practice, but we do see it from time to time, especially I guess when we're starting off. I'm not exactly sure because I'm not in that like part of my major yet. I'm still a junior, but I'm getting there.